And today, with a global emergency, that is what the World Health Organization is calling the explosion of cases of the Zika virus around the world.
They also warned by next year the number of cases could reach 4 million. So what does this all mean to us? Dr. Max Gomez with us right now to take us through that step by step, Doc.
That's right, Chris and Christine. You know, while Zika is spreading very rapidly in other parts of the world, the U.S. Centers for Disease Control says it expects limited outbreaks of Zika here at home. Meanwhile, Governor Cuomo announced today free testing for symptomatic individuals who have traveled to countries impacted by the Zika virus. Here's why there's so much concern. Mosquito-borne virus is spreading so rapidly throughout Latin America and the Caribbean that the World Health Organization has declared the Zika outbreak a global health emergency. The primary concern is that the virus infection is linked to a serious birth defect called microcephaly.
The clusters of microcephaly and other neurological complications constitute an extraordinary event and a public health threat to other parts of the world.
Microcephaly causes babies to be born with abnormally underdeveloped brains and very small heads. So far in Brazil, more than 4,100 suspected cases are reported. Dr. Margaret Chan of the WHO says while the link is still not scientifically proven, there seems to be a strong relationship.
All agree on the urgent need to coordinate international efforts to investigate and understand this relationship better. Members of the committee agree that the situation meets the conditions for a public health emergency of international concern.
The declaration of a global health emergency allows for a coordinated international response to try to minimize the threat in affected countries and reduce the risk of further international spread. Now, the WHO also said the connection between Zika and the brain birth defect is the main reason for declaring the health emergency. Otherwise, the agency said Zika is not a clinically significant infection, meaning that it just causes mild flu-like illness that lasts less than a week. And again, the real concern is for women who get infected primarily during the first trimester of pregnancy. Otherwise, it doesn't seem to be much of an issue.
And the vaccine issue, obviously not having one present at time.
Right. They're working on a vaccine. They said that could easily be a couple of years away. The main issue there is whether that virus is stable and you can make a vaccine, or it's like the flu virus that mutates a lot and it's a moving target that makes it much more difficult to create a vaccine.
Right.
But by declaring this emergency, they then can expedite trying to get that vaccine. Exactly. That's one of the reasons why they declared this emergency.
International.
Exactly.
That's the big thing that happens when they declare this emergency.
All right, Dr. Max Gomez, thank you.